My name is Dr. Eric Pifel. I am an orthopedic surgeon. When you come to my office and you tell me you have hip pain, the first thing I ask is, where is the hip pain? Is it in your groin? Is it in the buttock? Is it on the outside part of your hip? Because all of these can be associated with hip impingement. Hip impingement is an irritation or groin pain with vigorous activities. You would be at risk for this if you are an active person who has no arthritis, who suddenly goes from a period of no symptoms to significant symptoms with twisting and turning activities. People that run or jump will feel a catching in the front of the hip, a snapping in the front of the hip, sometimes a feeling like their hip is ratcheting, or sometimes they'll even hear an audible pop that will create pain and a feeling of friction in their groin. We take a look at you, we listen to what you have to say about how your symptoms have progressed over time. The next step is we get an x-ray of you in the office, including a pelvis x-ray, a side view of the hip, to make sure we don't see bony prominences that could potentially put you at risk for hip impingement. The third, if those first two are showing that this is probably hip impingement, we'll send you for an MRI. This allows us to see the soft tissues, including the labrum, the deepening cartilage inside the hip that sometimes is torn with hip impingement, the tendons around the hip, loose pieces, cartilage, all things that contribute to the process of hip impingement. If you're having mild symptoms, the first thing we try is modification of activities. If you're running a marathon and you're hurting at the 13th or 14th mile, we tell you to slow it down. Go to half marathons, go to a 5K, see if that diminishes your symptoms. That can work for some people, not everyone, and only for the most mild cases. If your symptoms are a little bit more extreme than that, then we talk about using anti-inflammatories, potentially therapy, including ultrasound, evaluation of gait cycle, those type of things that you do with a physical therapist. And if those fail, we talk about interventions like injections, especially if someone has some arthritis in their hip that is combined with hip impingement, especially someone who has no interest in surgery, because the next step after that is doing hip arthroscopy to go in, alter those bones and the soft tissue so we can diminish the symptoms that you're having.